Butorphanol is a medication that you will probably only see if you're working in like labor and delivery or OR, because what butorphanol is mostly used for, its trade name is Stadol. Okay, Stadol, and what it does is it's a lot of times used for moderate to severe pain, labor pain, and sedation before surgery. So most likely, if you use this medication, it will be labor pains for a patient who's having labor, or for sedation prior to surgery, okay? Working in the ICU, I have not actually given Stadol, and we have a lot of patients who have very severe pain, or who we do minor procedures on, or who we intubate and things like that, and even in those situations, I've never given it. So my guess is the most likely places you're going to give this will be in labor and delivery or sedation prior to surgery. So Stadol, generic name butorphanol, its action is that it alters perception and response to pain by binding to opiate receptors in the CNS, and thereby altering that perception of pain, how we feel the pain, okay, by binding to those opiate receptors. Therapeutic class is opioid analgesic. And by knowing this, you guys, so you know some of the nursing considerations that we're going to have. Before we talk about that, its pharmacologic class is opioid agonist, antagonist. And so it can have a withdrawal effect and a dependency effect with it. So some of the nursing considerations we need to keep in mind, knowing that it's an opioid analgesic and that it binds to these opiate receptors in the CNS, we know that we need to monitor for CNS depression, right? It's going to depress the CNS, which means that we need to monitor respirations, we need to monitor blood pressure, heart rate, all those things that are going to be altered by any of these CNS depressant medications. One big thing to keep in mind too is that you want to use caution with concurrent use of MAOIs. We don't want patients who are taking MAOIs to necessarily be taking Stadol. So that's something that you're going to want to watch for and that you're going to want to monitor these patients with. It can cause confusion, hallucinations, and obviously sedation. So again, just be very careful with these patients as you're giving them this medication, that you're monitoring them closely. So again, assess blood pressure, respirations during administration, and administer very slowly through an IV line, okay? So those are the big things to keep in mind for butorphanol or Stadol. It is an opioid analgesic, and so you just kind of keep in mind those CNS depression side effects, and you don't want to give it concurrently with an MAOI. This has been another episode of the MedMaster Podcast by Nursing.com. To get your free copy of the 140 Must-Know Meds textbook, head over to nursing.com/140meds. That's nursing.com/140meds. When you head over there, you get a free copy of this book. All you have to do is pay for shipping. We love you guys. Now go out and be your best self today. Happy nursing.